Fix it.
So everybody, what motion am I doing? What motion am I checking?
Flexion extension.
Flexion extension, great. What motion am I checking?
Abduction.
Good, okay. So the reason that gets confusing is when your hands are at your side, this is abduction. So some people think that this is abduction, but abduction means away from the midline. That's literally what it means. And when you're abducting, you're going away from the palm. So that's why this is abduction, and that's adduction. Just another way to help you remember it. If you understand it, you'll remember it. Okay? So for flexion extension, I'm going to have the patient like this. It's concave in this direction. Remember, there's a saddle joint, so it's going to change, but it's concave, so I got to push with the motion. So the metacarpals are easy to find. They're these long bones, yes? All the metacarpals are nice and long. So I'm going to feel the end of the metacarpal, and that's the trapezie group. If I go one proximal to the trapezie, I'm on scaphoid, and then I could go radial styloid. So you can count radial styloid, scaphoid, trapezie, metacarpal. You can do that. Radial styloid, scaphoid, trapezie group, metacarpal. It's just easier to find the metacarpal. Just kind of wiggle it. You'll feel the joint line. You're just going to block the trapezie group right there. You're just going to squeeze it. Just a little squeeze like that. Okay. All right. Now my ulnar glide is flexion. With my finger in the same position, my radial glide is for extension. Ulnar glide for flexion, radial glide for extension. I'm just squeezing that metacarpal between my thumb and my first PIP digit there, just like that. I just got it just like that, a little pinch grip. They call that a pinch grip. Ulnar glide, radial glide. If flexion, if I ask her to actively flex or oppose the thumb and she can't do it, and I assess the joint and it's a range of motion, it's a joint capsular tightness, I'm going to do grade 4. If she's lacking extension and it's a joint capsular tightness, I'm going to do a grade 4 that way, which looks like that. Hers is really loose, so I'm not going to do that. If there's just thumb pain, a lot of people get CMC joint pain. I'm just going to wiggle it. That's my grade 2 oscillation. Okay. So then I want you guys to watch this. If it's ABA deduction, watch your hand position. So that was the position for the flexion extension. Watch this. You just spin your hand a quarter turn. This hand doesn't move at all. I still got the block. So that's on the radial. I just spin it. Now that's volar glide, dorsal glide. Okay. Volar glides for adduction. I'm going to use, for dorsal glide, I'm going to use my knuckle here on the first finger or second digit here. I'm just going to do that. I'm just going to radial deviate my hand and push dorsally. And that will improve abduction. Does that sort?
Yeah. She needs it.
Yeah. So her whole CMC joint is a typical, this is what a lot of therapists get. They use their thumbs a lot and they get loose CMC joints. So the thumb, plantar fascia, shoulder, back, cervical, these are all areas that therapists need to be careful with. If it's loose like this, the treatment is oscillation for pain and then a lot of coordination exercise, 3 sets of 25 in all directions. I would give you, if you're my patient, I would just oscillate this in multiple directions, probably just in this direction because that's the easiest one to do for you. This one feels a little different, so I would just do that. And then I would give you the rubber bands, and I'm going to do AB adduction and flexion extension with you all 4 directions. And then get some Theraputty. Okay, maybe if you got the Digiflex, but that you only can do here, so I'm going to give you things to do because 60% is once or twice a day at home. So you're going to have 15 minutes exercise to do once a day. Okay? That would be my treatment for hypermobility, the CMC. All right.